the hopes of cancer patients and their families rests on the twin pillars of patient-centered care and an understanding of value, not just the cost of treatment.
The paper that was highlighted that Ed talked about that was written for this particular conference, you should read, because it really lays out the problems in a stark way.
Innovative medicines are what patients want. They're necessary.
I think where we have very common ground is we need the trials.
It's that process of clinical studies that reveals the value.
While we need to focus on cost as one of the elements, I do think we need to elevate the conversation to value.
If we're going to keep spending more and more on drugs and fancy radiation technology, we're going to have less and less to spend on patient-centered care.
I personally am very weary of the drugs and biologics being the lightning rod in this discussion.
All parts of the community working together is going to be important in order to push forward value and innovation in cancer. And I think that's also highly relevant as we think about getting the patient at the center of the process.
We need to have a culture that encourages discussions about values and principles that are right for individuals, respect those individual principles and rights, and abide by them as a medical system as opposed to shoving everybody down a chute.
All of us in the medical community have an important role to play in restraining costs and creating value for our patients.
This is where we need the cooperation to bring the drugs to the patients, the companies working with the academic centers, with the NCI.
There is no one in this room who isn't thinking about patients every single day. But where there's a little bit of a disconnect is what are we doing for patients versus what are we doing with patients?
We have to do better by patients.
It doesn't matter whether you're making drugs or providing insurance or building a hospital, we will all have to figure out how to treat more patients with less resources.
We are committed to working with leaders across the oncology community to develop evidence that we need about the value of new treatments, the tests, and the services that can improve the life of cancer patients.